Hey everybody, Tim Albrecht here, and thank you for listening to the YFP podcast, where each week we strive to inspire and encourage you on your path towards achieving financial freedom. This week I had the opportunity of sitting down with emergency medicine clinical specialist and entrepreneur, Dr. Jimmy Pruitt. During the show, we discussed what led him to start the Pharmacy and Acute Care University, how Dr. Pruitt has monetized his clinical expertise through developing masterclasses, workshops, reference libraries, community forums, and webinars, how he has balanced the start and growth of his business while working full-time, and the role that his business has played in helping him achieve his financial goals. Before we jump into the show, I recognize that many listeners may not be aware of what the team at YFP Planning does in working one-on-one with more than 250 households in 40-plus states. YFP Planning offers fee-only, high-touch financial planning that is customized for the pharmacy professional. If you're interested in learning more about how working one-on-one with a certified financial planner may help you achieve your financial goals, you can book a free discovery call at yfpplanning.com. Whether or not YFP Planning's financial planning services are a good fit for you, know that we appreciate your support of this podcast and our mission to help pharmacists achieve financial freedom. Okay, let's jump into my interview with Dr. Jimmy Pruitt. Jimmy, welcome to the show.
Oh, thanks for having me on. It's been definitely a pleasure to, get started with this and talk to you guys a little bit more about your financial pharmacist.
Yeah, I'm really excited to share with the YFP community about how you've been monetizing your clinical expertise, a topic we've been talking more about on the show over the past couple of years. But first, before we get into all of that, tell me what drew you into pharmacy, where you went to school, and when you graduated.
Perfect. I was fortunate that in high school I had a chemistry professor that really challenged me to think more outside of sports because my plan A was to go to NFL and got lucky and went to a pharmacy school that had a football program, and it was great. So I went to undergrad at Presbyterian College and went to pharmacy school at Presbyterian College, and was fortunate that I was able to live out two of my passions with pharmacy and football, and really it gave me the background to want to connect with a team, to be a team leader, and to just produce something more than what I'm used to. So that was really my background, and just being good at chemistry, being good at math, and really taking a special interest to the medications.
And so you graduated from Presbyterian in 2017. Tell us about the career path since then, post-graduation residency, and the initial clinical work that you've done.
After pharmacy school, I went to Advent Health Orlando and was able to get a very good foundation at that very large program. It's one of the top five largest programs in the nation. And from there, really solidified me enjoying the acute care side of things, and particularly the emergency department.
Mm-hmm.
Then from there, I went to Grady Health Systems in downtown Atlanta, where I got to see and do more than I can ever imagine. And that was just phenomenal. And more particularly, being able to see and manage those critically ill patients
Mm-hmm.
in a manner that most pharmacists in the laws don't really allow them to do. So I really got hands-on with those patients, and really working with physicians, nurses, and things of that nature. It really helped me understand my expertise. And then from there, my first job outside of residency was at Augusta University Medical Center, which is another large academic medical center that has a level one trauma center. Really got my hands dirty there, and I was also still working at Grady Health Systems on my off time. So I worked quite a bit that first year and a half. And as of lately, I went to the Medical University of South Carolina,
Mm-hmm.
which is another, again, large center and trauma center as well, where I'm also part of the faculty at the School of Pharmacy and teaches on the acute care side of things.
Well, no wonder why you're busy. Before we hit record, I asked you, hey, how are things going? You said, bit busy. It makes sense. You've got a lot going on, and we'll talk about the business in addition to the full-time work here in a moment. But I'm going to brag on you for a moment, because a lot has happened in a relatively short period of time. So you graduated pharmacy school 2017. You did residency training, as you mentioned, PGY1, PGY2, and you've had quite a large amount of success as a new practitioner. You were honored with the Excellence in Diversity from MUSC College of Pharmacy. You were the Alumni of the Year from your alma mater, also the keynote speaker for their graduation in 2021. You started a podcast, Pharm So Hard. We'll link to that in the show notes. And as we'll talk about here today, Pharmacy and Acute Care University is really the business that you have been building to help clinicians that are wanting to improve themselves as it relates to that area of practice. So let's jump into that. Tell us about when you decided to start Pharmacy and Acute Care University. We'll link to that site in the show notes, but it's pharmacy-acutecareuniversity.com. when you decided to start it and why you started it. What was the genesis and the origins for doing that?
Absolutely. So the precursor to pharmacy at Acute University was, I think I used to call a blog called Pharmacy Frothy Pearls. And what it was initially, that was just a short form, a handout is usually front and back that really summarized a disease state or a particular topic. And many people really enjoyed that. And I was fortunate to win like SEM's Got Talent for that. But people wanted a little more. And I kept trying to make Pharmacy Pearls larger or more in depth, but
Mm-hmm.
it really wasn't what people wanted. And as I continued to build websites and continue to get more involved in the podcast, I wanted to see if there was a way for me to monetize some of this so I can build these platforms. And really, the next step for me was to figure out a way to, okay, build something people want and go from there. So about last year, I was able to really go about doing things where I planned out what would this look like.
Mm-hmm.
And the step for me was to be able to go for it and create a university or academies where I can build things that not only myself but other preceptors, other individuals can be part of. And it really was something that was I just figured out if you want a topic, let me know. And I asked people what they want, and I looked online to figure out what are the disease states people are interested in, what the thing they're missing, and I really start to build upon that. And it really was the thing I want to separate, being able to give people things they need from a free standpoint with my podcast and pearls, but then be able to get a little bit more in depth and provide some more value.
Critical care is certainly not my area of expertise, emergency medicine, critical care, but I know enough within the profession that, this is a topic that certainly there are, groups within pharmacy associations. There's large critical care organizations outside of pharmacy that are well respected and, certainly ones that clinicians go to for resources. So what was the gap that you saw? What was the opportunity that, as you looked at those other quote competing resources that were out there that you felt like, there's a gap here that we really have an opportunity to build something that can supplement those resources.
Absolutely, Sam. So one of the things that I noticed was that unfortunately, when you get so big, that a lot of the resources are really catered to a large percentage of practitioners.
Hmm.
And what I wanted to do is figure out what are the things that I need on a day-to-day basis that are necessarily not there. So some of the times I spent a large percentage of my time collecting resources,
Hmm.
collecting and organizing resources, and I really wanted to figure out if there's a way for me to have all that in one click, it would save me hours of time. And also, I thought about as a resident, I spent even more time trying to figure out what is actually useful.
Hmm.
What do I actually need to read? So that was the first thing that came to me with the reference library within PACU was figuring out what do I need that's not currently there and what I spend the majority of my time on as a resident and then now as a preceptor. So I started going through different aspects and figuring out is there an easier way or a more convenient way to organize these resources? And that was like the first step to this. And then I thought to myself, how can I make this more all inclusive so I don't have to go to 5 different websites? Because what I noticed was I would consume a ton of content, but I had to go to 5 or 6 different websites to get that information,
Hmm.
or I had to spend a significant amount of money each time I got those things when I only really wanted one topic or so. So that was the basis for me creating a platform that included all of these things. And really, it helped me understand that maybe there's a niche there for me to be able to go in and talk about the things that I do. And emergency medicine is being one of the newer specialties and really build from emergency medicine outwards and go from that to critical care to internal medicine. And really, I thought about all of acute care pharmacy. There are certain things that we can build for them that they're needing. And a lot of the content I build is based off what people send me questions on and things they say
Yeah.
that they need. So that was really the niche that I picked up on.
Yeah, so valuable information to hear there, right? It's one, you're living it as a clinician. You went through the training, you feel the pain point yourself. And then I think you mentioned a great point there as well that something that resonates with me at YFP is questions that come in, you start to see themes and repetition. You start to pick up on, okay, what are the pieces of content? What are the resources that would be helpful to serve people in the community? When I take myself back, Jimmy, to being in pharmacy school, which was a while ago, I graduated in 2008, and I remember going through rotations and like critical care was overwhelming, and it wasn't, as quickly realized it wasn't for me. But I remember working with a lot of critical care practitioners, and I can see why the resource you've built is of such value to them. You mentioned one thing already that there's so much information, different, resources that are out there. So maybe not something available as succinct as it could be. And obviously, you're trying to address that pain point at the academy. I also, when I think of critical care, I think of the confidence level that's needed among the practitioners, and just the amount of information, the urgency of some of the care situations, time management, just the overall competence of the practitioner. Are those other things that you're seeing in the community where folks that are interested in your model might be struggling with some of those areas as well?
Absolutely. And those are the ways that I'm trying to address that through like our community forum and just be able to have a conversation because a lot of times where depending on where your practice or depending on where you're doing your training, you may not have people that you can talk to that's been through these scenarios that they're training you on.
Mhm.
The patient population may not be big on that. So a lot of the times we're having mentor sessions. A lot of times we're having one of the things I'm working on for next month is giving a class based off resources to use to save you time and to organize yourself.
Mhm.
So all
Mhm.
these things we're looking at ways and where we can create content for people, not just on the clinical side of things, but also on the side where they are able to organize and to be able to be a little bit more confident and maybe having one-on-one conversations with myself, maybe having one-on-one conversations with others. And that's where I think that we're unique because we're small enough to take the needs of our clientele and say, okay,
Mhm.
what else do you need? And then I can go and use the podcast. I can go out and use all the other social media platforms that I've been successful on to find these people and to give them what they need.
When I look at your mission, Jimmy, it mentions to empower healthcare providers with the knowledge and skills they need to provide evidence-based safe care for critically ill patients. So that terminology, healthcare provider, suggests it's broader than pharmacy. So are you building an interprofessional platform? Is it mostly pharmacists? Tell us more about the demographic of your audience.
Absolutely. So as of right now, the majority of our audience is going to be pharmacist based. But again, we do have a few nurses, we do have a few physicians.
Okay.
And the ultimate goal is to be inclusive of everyone who utilizes pharmacotherapy to treat patients. So the
Hmm.
big goal, I want this to be something that everyone can use. And we have some different plans for the end of the year in early 2023 where we can provide certain solutions to medical residency programs.
Hmm.
There is an interesting component to where they have, at least for emergency medicine, they have a pharmacotherapy or pharmacology section within their training that needs to be marked off.
Mm.
As of now, there is not a standard of
Hmm.
how to satisfy that. So the more and more I teach within the residency program, I have a standing position where I teach once a month to our medical residents. And I'm noticing they really value that. And
Hmm.
what if you don't, your residency program doesn't have a pharmacist? What if you don't have an EM pharmacist in your program? Then eventually we can get to the point to where we can provide some resources for those practitioners as well. The same thing I get from the NPs and PAs. They want more pharmacy related content from pharmacists that's actually practicing at the
That's
bedside.
right.
And I think that's the unique component of where we're trying to take the platform and again grow this to where it can be everyone. But again, we provide you what you need and
Hmm.
create it in such a way that is suitable for that particular person at their time in their training.
I think that's a really interesting niche. The medical residency. Again, you're living it. You're teaching and working at a large academic medical center. You work with medical residents, right? So you can design and customize curriculum and experiences in a way that will be meaningful, that have been tested. But to your point, not every medical residency program has access to a pharmacy practitioner. And, especially if you're looking at something like achievement of goals and objectives within a residency program, it's a really interesting opportunity. And to further that point, one of the unique aspects is you look at potentially marketing products and services out to residency program directors is there a pretty well defined market. You can figure out who they are and begin those communications, and the network of those folks is relatively small versus blasting out the service more broadly. So tell us more about Pharmacy Acute Care University. What do you offer? You've mentioned a couple things with the reference library, community forum. What are the core offerings of Pharmacy Acute Care University?
Absolutely. So we have a few. Again, our main ones I've mentioned before is the reference library, where again we collect this content and save you time by putting it to where you have a quick review. So where we not only we give you the guidelines and the primary articles, we can give you review articles and something that other places and other platforms haven't included is the podcasts and blogs that are out there
Mm.
that are also pretty useful. We get all those things together because we know that our resident, we know that our physicians and PA and PCOs are using those blogs. So why don't we look at those, examine them, and see if they're useful, and provide them with something they're going to use as well.
Hmm.
The other component of that can be our masterclasses. This is our traditional course. I think this is something that most people are familiar with, where you go through some modules, you answer a few questions, there are some videos and different multimedia. Again, you can do on your own time, like an on-demand class.
Hmm.
The most popular of our platforms are going to be the live seminars, and that's basically you have a live event to where I open this up to everyone, and we can get some continued education credits for it as well. And we do those at least once a month, and that's again open to everyone. And then from there, if you want to get access to the slides, you want to get access to the recording or continue education, there that can be available inside our membership.
Hmm.
And lastly, something that's new that our audience asked for was literature reviews. So where we
Mm.
examine an article every other week, and we're going to continue to expand this, and we break down an article based on our review. So we read the article, we provide our analysis of what it is and how to utilize that within practice, and we send you a summary of that to your email. So if
Hmm.
you can listen to the 5 to 10 minute spill on it, you can. But if you just want to get to the bare bones and add that to your knowledge, we have a handout that we send you every few weeks that you can just get continued updated information that's out there in the literature. And lastly, for our more advanced practitioners, and really everyone can use this, is our patient case questions. So we can provide you information up front, but how do you know if you really know it?
Hmm.
Or you think I'm an advanced practitioner, I know these different things. Well, how about you test that knowledge and see if you really do, and see if you can do some space retrieval and bring back some things that you probably haven't studied in, maybe a couple months or even years. So
Hmm.
that's one of the things that we've added on to where this is why I call PackU a complete, a all-in-one platform, is simply because we can teach you something, you communicate within the community forum, but you can also test yourself and get continued education. So you don't really have to leap outside of that ecosystem that we've created to get almost anything else. And if there is, again, I made it to where we have a wish list within our forum
Hmm.
to where you can put in what you want, and I work on using my network to build those things.
I love it. Such a cool example of how you've been able to monetize the clinical expertise, but also be able to fill a gap that's out there and be able to serve other pharmacists and healthcare professionals with these resources. I want to dissect a little bit of what you've done, because I think for many that are listening that say, hey, I think I could, monetize my clinical expertise. And that could be building something like you've built it. Or I'm also thinking about, a shout out to Kelly Karlstrom at Kelly C PharmD that has built an incredible community for oncology practitioners. Or it could be somebody that is thinking, hey, I want to contribute to a community that already exists, one like Jimmy has built or one like Kelly has built. But that can be overwhelming to think about building something. And so I'm looking at your site, and you've described all of these products and offerings. You've talked about a reference library, masterclass, community forum, live seminars, a membership feature. You've talked about literature reviews, which you've launched more recently. There's a membership component to log in. You've talked about a podcast, a blog, a social community. There's a lot of pieces that are there. And so the question is not just the time investment, but also like the where do I start? Where do I start? So if
Hmm.
you take yourself back to the beginning of this journey, and obviously you've evolved and built this over time, and you have plans to continue to do so, as you just mentioned, where did you start from idea to, hey, I just want to take one step forward on this path towards building this vision? What were those first one or two or three steps that you took to build what is now up on the website?
I think the big thing, particularly when looking at pharmacy and acute university, and I call it PACU for short, the
Mm-hmm.
first thing that I did was I knew that I didn't know much about building this platform. One of the things I did was actually end up reading a book called Who Not How by Dan Sullivan. And it really opened my mind, because the first thing I did was read that book, and I realized that I didn't have to know everything.
Mm.
And once I got out of that fear, it's more of a mindset shift. So I think the first
Mm-hmm.
step is just figuring out where your mindset currently is and asking
Mm-hmm.
yourself, what do you want to do? Do you want to educate people? Do you want to connect with people? And for me, one of the things that I enjoyed the most was educating. It is something that I did within residency first,
Mm-hmm.
with just doing the pharmacy pearls. And that was something that I just did for the Emory residents. And I just did on a Friday. I would get a small topic and go from there. And I realized that was something I really enjoyed. And I thought to myself,
Mm-hmm.
if there was a way for me to bring that type of information, that feeling that I got, to a wide source of people, and if I can make a business around it, would that be something I can do? And I know I knew at the time I didn't know how to do that, but I read that book and it was Who Not How. Then I realized, I say, okay, who do I need to know, or who knows this type of platform that I can build?
Right.
And I got a podcast called The Membership Guys,
Mm-hmm.
and they would talk about how to build their own memberships, and I read a book on that, and then they walked me through step by step. So I think the mindset was first, and then figuring out that there's other specialists, and that's what's the first step for me, just reading a book.
Mm-hmm.
The very first step was reading a book and figuring out that I really enjoy educating. So the book, the mindset change, and just figuring out what, at the simplest level, what do you want to do? And
Mm-hmm.
for me, it was figuring out a way to educate and connect with people.
I love that, Jimmy. And the reason I asked the question, and I can remember it in my own journey, is a lot of people will start with an idea. And if you think about this like a visual of a roller coaster, you ride that energy high of the idea, you've got a solution to a problem that you see out there, and then you start to get into the weeds, right? And some people jump into WordPress, some people jump into logos, some people jump into how am I going to price my products or services or offerings. And that is typically where people get hung up, they might get lost, they might get overwhelmed. And I think the advice you gave around mindset shift and even that next step of a book, right? It was Who Not How by Dan Sullivan. We'll link to that in the show notes. But that's one tangible step. I can read something, it can evolve my thought process. It can open up my eyes to, before I get into the weeds, who might help me on this journey along the way, and make sure that I can keep that momentum going forward. So my question building on that, who not how, is as we look at PackU and what you have offered today, I've gotten the impression based on our conversation that it's not just Jimmy. There's other people that are involved in the business, whether that's contributors, whether that's contractors that you've worked with to help you build out the site and other things. Is that fair? And if so, tell me more about the infrastructure of who's helping you build the community that you have.
Absolutely. One of the things that I told when I first started off, I didn't want to make this about me because, again, at some point, I won't be able to do all aspects of this. And it became very overwhelming when I thought I had to. So after I read that book, I said, okay, I need a website. So it's like, okay, who can build a website? So I went through and looked on, Free Up, I looked on Fiverr, I looked at all these different platforms, and I just interviewed many different people. It got me the first person, and I had a good interaction with that. And I said, okay, how can I get more people?
Mm-hmm.
And I did trial and error of finding different virtual assistants, finding different contributors, and I came to the point to where I said, okay, I have a basis of people who can web design and develop. And the next step was getting someone who can handle some of my more operational tasks. So
Yep.
I hired someone on for that. And then the next big step that I think is not only going to help me, but I think it's going to help the majority of the community is when I started getting guest writers and guest presenters to come on,
Mm.
and people really enjoyed that. And what I started to realize is that many people, they want a platform to present. They want a platform to display what they know because for one reason or the other, if they don't have a certain credential, or they didn't go to a certain school, they may have been overlooked for these presentations because you only have so many national conferences and ways to present. And people need it for their CV. People need it for their own confidence, to be honest.
Mm-hmm.
So I started reaching out and asking people on Twitter, hey, who will be interested in contributing to the platform? And there's many ways you can do it, whether you like to speak or not. And I noticed that there are certain people who just want to give presentations live.
Mm-hmm.
And then I noticed there's a group of people who they wanted to contribute, but they really didn't want their face shown. They really didn't
Mm-hmm.
want to be heard. They really don't like their voice. And I would say that, a little bit over 60% of my platform can be produced not with any voice, not with video and things of that nature. And people really took hold to that. And now we're to the point to where we have a rotation of probably 20 to 30 pharmacists that contribute
Mm-hmm.
on the platform. And that's when things really started to take off because I started being more from a managerial and more of an operational standpoint and being able to assign work, assign tasks, and really use my platform to connect with people
Yeah.
versus having to worry about creating the content consistently.
Mm-hmm.
And that's really given me some satisfaction in my personal life. And I think I've been able to meet more people that I wouldn't have met if I wouldn't have reached out to them being contributors.
That's a really important evolution in the business because I think that as you're talking about here, you have 20 to 30 plus contributors, and obviously your time is a finite resource from your sanity as well as just hours that are in the day. But I would also argue, and I think your point about, hey, this can't just be about Jimmy is a really important one because if you're solving a problem and filling a need that's out there in the market, your time was eventually going to become a rate limiting step to what you were going to be able to achieve in terms of the value you were going to provide to the community, right? And so, I think as you're now building out this infrastructure of contributors, obviously you're able to begin to expand the work and the reach of that. Let me ask a follow up to that, and I think maybe some folks might be uncomfortable with that span and control. Yes, I get excited about the mission and the work can move forward, and I'm not always writing them, but am I losing potentially the quality or the span and control? How do I oversee all this? So has that been a challenge for you, or what have been some systems that you've built to help with that?
Absolutely. One of the things that happened initially is I was getting some work done, and I got medical writers that can help with, creating some of this content. And I noticed that it just wasn't up to par from the advanced practitioner.
Hmm.
And I noticed a big difference when a pharmacist created my information versus someone who wasn't necessarily within pharmacy, or I would say wasn't in acute care pharmacy.
Mm-hmm.
And I noticed that as I'm getting ready to review this information, it was so much that I had to change. And I noticed I said, I need someone who gets it. I need someone who understands it. And maybe the next rate limiting step was me editing that material. So one of the aspects of how I added on, I say, okay, I'm gonna have a contributor who can make the content, but also have a contributor who's my editor,
Mm-hmm.
who edit this stuff before I see it to get it cleaner
Yeah.
and go back and forth from that standpoint. And that really helped out quite a bit because it made me feel more comfortable with that content moving forward versus me thinking I have to change this, I have to change that. And I'm already making content as well. So that was the big step. But it did make me feel a little uncomfortable again because some of the things that was important to other people, other editors, wasn't necessarily as important to me. But I realized it may be important to my audience, and
Sure.
that's where it really became more prevalent that I needed to make sure I empower my editors, I
Mm-hmm.
empower my contributors because again, they're going to be the ones that build this platform to really be something that's much bigger than what it currently is now.
So as I hear you talk about this journey and the work and the systems and the processes that you're building out, I think a natural question is, Jimmy, how you doing this, right? So you're working full time. You're working in a large academic medical center. You mentioned a teaching component, which anyone who's been in a shared faculty role, that in and of itself can feel like more than one job. You're teaching trainees, I suspect medical residents, pharmacy students, medical students. So how have you been able to balance this, or maybe balance isn't even a thing as you're getting it off the ground? But tell us more about the strategies that you've employed to be able to work on this and move the mission forward, but also, make sure that you're keeping yourself well throughout the journey.
I think one of the biggest things that came up was I had some advice to make sure you make again systems for everything.
Yeah.
And I didn't necessarily know what that meant until I started building this because again, when you're by yourself, you're the system. But
Yeah.
when you start to train other people to do a task and you realize that you have to give very detailed instructions or you're going to spend more time revising things. So I started using, again, everyone has their own productivity manager. I use the platform ClickUp, and that's where I basically have everything live. So everything has its own bucket. And within there, everything has their own subtasks and different
Hmm.
checklists to get a single task done. And I've worked with my assistant to where some of the more difficult tasks, I would have her go through it, but then create instructions on each step
Yep.
and take pictures and do different things like that. So when I assign this task to someone else, they can go through and pretty easily get those things done. And once I
Hmm.
built up a big base of that, I started using it for everything. So even for in my role within my course, every class have a certain lesson plan. Every class have a certain setup, a certain things that need to happen. I have made templates for emails I'm going to send. I've made templates for topic discussions that I have. So all of these things have their own system now. And now it's been a couple of years where if I've done it 2 or 3 times, I just spend a little extra time making a system out of it.
Document
And
it.
I just
Yep.
use that over and over again. So now it takes to where I can focus my time on creating new platforms and creating new systems. And all the ones I've done in the past, I just
Hmm.
reuse that. And it's been phenomenal for me in saving time. And again, almost everything that I do now, from the production of a podcast, from creating the conference, I've done it now more than once, and it's
Yep.
easier for me to be able to put those things on autopilot, so to say.
I love that, Jimmy. I did an episode recently, 265, where we talked about, we'll link to that in the show notes, 10 lessons learned from employed entrepreneur. And that was one of the things that I talked about because it's so important as you think about, again, how can this continue to grow and evolve? And the question I encourage folks to think about that are beginning as a solopreneur and looking to build out some of these systems is, if you were to walk away for a month, right, you're to take a break, something were to happen that you needed a month off, like, would the business be able to continue to go on and ideally grow in your absence, right? And that question really forces okay, what are all the hats that I'm wearing, and are things documented in a manner that someone else could be trained up, and ideally over time people are able to take on those roles so that you can continue to move forward and grow the business. Two books I would recommend on this concept that Jimmy is talking about here. We'll link to these in the show notes. E-Myth Revisited by Michael Gerber. Great book that talks about the concept that Jimmy just outlined. And then Procrastinate on Purpose by Rory Vaden talks a little bit about this concept as well that I think folks may find helpful. Jimmy, my last question for you is, given this is a financial podcast, one of the big upsides I see as a side hustle or a business, especially as people are working full time, is that it allows them to supercharge and accelerate their financial goals, whether that be debt repayment, saving for the future, having some extra cash on hand, whatever would be the case. So my question is how has developing PackU, how has that helped you reach or advance your financial goals that you're working on?
Absolutely. I think one of the big things is during this same time frame, reading and developing myself for this, I've learned where it's the best to place money and how to have money, work for you.
Yeah,
And the biggest thing is as additional income start coming in, I realized that okay, I could really make this something to where it can not only supplement income, but potentially with greater success, being able to kind of take over part of that.
that's right.
So it's really helped me. The ideal of retirement has completely changed in my mind. It used to be an age, but now it's a number.
Hmm.
So when I talk to my family and I talk to everyone around me, there's a certain number that I have to get to per month to where I feel that I'll be comfortable enough to not be full time anymore.
Hmm.
I know what that number is for part time. I know what that number is for 0.75 FTE. And it's really changed my mindset. So the biggest benefit to me is understanding that not only can money work for me in other aspects that when I benefit from it from PackU, but it also is going to allow me more time to spend time with family, to travel, do things of that nature. So it's actually giving me a different approach to what retirement looks like
Hmm.
and really to feel comfortable in that space. So that's the big thing for me is spending more time with family and change the mindset from when to
Hmm.
what that number looks like.
It's great stuff, and I think as you talk about it's a number, not an age. We've talked about that on this show, and one of the things that gets me excited for your journey is not only is it about being able to spend more time with your family and friends and enjoy the experiences you want, but also connecting to our conversation just a moment ago, because you're building the systems and processes, onward will go the mission of what you're working on, right? Because you're going to have other folks that are involved. And so as you're spending more time with family and friends and enjoying those experiences, the company, the mission, the work can still advance even in your absence. So this has been awesome. So excited for you, Jimmy, and what you have future in your community. We'll link again to the PackU website. Where is the best place that listeners can go to find you and to follow your journey?
I think Twitter is going to be the best place to catch me. Where I'm the most active at farmd underscore in the ed. That's
Hmm.
why I spend a decent amount of my time. Again, if you're interested in the PackU platform, we have platforms on all the social media. So LinkedIn, YouTube, Twitter, Facebook, all those things. We have platforms there. So again, I'll be aware of any information that's coming into those platforms, and
Hmm.
Twitter is probably the easiest place to catch me. Again, farmd underscore in the ed.
Awesome. Thank you so much, Jimmy, for taking time to come on the show. I appreciate it.
Yeah, Tim, it's been an absolute pleasure. Again, been following you guys for a while, and this is something that, again, is really I'm looking forward to.
Thank you. As we conclude this week's podcast, an important reminder that the content on this show is provided to you for informational purposes only and is not intended to provide and should not be relied on for investment or any other advice. Information in the podcast and corresponding material should not be construed as a solicitation or offer to buy or sell any investment or related financial products. We urge listeners to consult with a financial advisor with respect to any investment. Furthermore, the information contained in our archived newsletters, blog posts, and podcasts is not updated and may not be accurate at the time you listen to it on the podcast. Opinions and analyses expressed herein are solely those of your financial pharmacist unless otherwise noted and constitute judgments as of the dates published. Such information may contain forward-looking statements which are not intended to be guarantees of future events. Actual results could differ materially from those anticipated in the forward-looking statements. For more information, please visit yourfinancialpharmacist.com/disclaimer. Thank you again for your support of the Your Financial Pharmacist podcast. Have a great rest of your week.